Good morning to all. I am Jaffna, nursing graduate. Now I am currently following the Tertiary to PhD at the University of Colombo. I am going to present my research title is Determination of Reactive Leptospira Serovars in Leptospirosis using Microscopic Agglutination test at a Tertiary care center in Jaffna. This is one part of my postgraduate research. Leptospirosis is a zoonotic bacterial disease caused by the genus Leptospira. The following species were identified in Sri Lanka causing disease in humans. There were Leptospira indrogans, Leptospira bourke-petersenii, Leptospira whaley, Leptospira hershneyi, and Leptospira sanderosei. Leptospira whaley is identified in the wet zones. Microscopic agglutination test is considered as a gold standard method for diagnosing leptospirosis in Sri Lanka. So generally, Jaffna is considered as low endemic for leptospirosis, but in last year, 2024, there is an increased number of cases reported to the epidemiology unit. You can see in this graph, there is a sudden increase in the reported number of cases to the epidemiology unit due to an outbreak. There are 188 cases were reported with severe mortality. Since Jaffna is situated in the dry zone and irrigation-based paddy farming method and flooding risk, there were several studies were done in wet zones related to leptospirosis in Jaffna district. So Jaffna district is under study and had limited data. So there is a need to identify the reactive Leptospira Serovars because it can lead to identify the local transmission pattern, diagnostic protocol, and the specific treatment methods, and find out the main reservoirs. So for this reason, I plan to do the study. My objective is to determine reactive Leptospira Serovars in leptospirosis among microscopic agglutination test positive samples from patients admitted with acute febrile illness to Teaching Hospital, Jaffna. It is a descriptive cross-sectional study conducted among the acute febrile illness patients and clinically suspected with leptospirosis patients who are admitted to the medical wards at Teaching Hospital, Jaffna from September 2023 to February 2024. A total of 102 samples were collected by consecutive methods. A 2.5 ml blood was obtained from the participants in the acute and the convalescent phase. After that, the serum was separated at Faculty of Medicine, University of Jaffna, and stored under -20°C. After that, it was transported to the Public Health Research Laboratory in Radharatna University to perform the microscopic agglutination test. The MAT test was performed with 11 panels of serovars. Initially, screening test was done. After that, run-out test was done to confirm the leptospirosis. So, among the 112 samples, there are 80 acute and 32 convalescent samples. Only 5 were confirmed as having leptospirosis. Among the samples, on 7 samples were reacted with multiple serovars. So here, these are the Leptospira species and the serovars were identified in samples. Leptospira biflexia was identified in the 5 samples. Leptospira bourke-petersenii Serovars seronica was identified among 5 samples. Among the Leptospira indrogan species, Serovar bataviae, Canicola, Bratislava, Iter hemorrhagiae, Beaver-Singlet, Wolfie, Mangaso was identified. Among the Leptospira sanderosei species, Serovar Georgia, Pyogenesville were identified. A maximum titer of 1/1600 was observed in the Leptospira indrogan species, Serova bacteriae, Canicola, Vertislava, and Icterohemorrhagiae. And the maximum titer of 1/800 was observed in the Leptospira biflexia and the Leptospira both predatory species Serova seronica. So according to these findings, it highlights the need for establishing regionally optimized man panel specific for the Jaffna district. It can support in the surveillance, treatment protocol and public health planning. So I sincerely thank to all my supervisors and the participants who have participated in the research, and all the supervisors who are guide and support in my research project. So these are the references I have followed, and thank you.
Great. Thank you so much, Michelle.